Hello everyone, welcome to Saptapadi Vivah presents Gupshup with you. I am Dr Snehal Sukhatankar. In our country India, we believe education should begin when child is not even born. As per Hindu epic Mahabharata, it is said that Abhimanyu learned war skills while he was still in his mother's womb. It is also said that Bhakta Prahlad's mother used to listen to a lot of devotional songs when she was pregnant with him. And that's the reason Prahlad was a true Vishnu Bhakt in spite of being born in Asura clan. Today's medical science is also focusing on emotional well-being along with the physical and mental health of a child. That's the reason every newly married couple, prospective brides and grooms need to be well prepared before they actually have a baby in their life. On that ground, we have an expert today on our platform, Dr Manisha Bhandankar ma'am. She is a neonatologist. She has done MRCPCH from Royal College of London, PhD in Transitional Adaptation in Newborns delivered in tertiary care centers and primary health centers. She has done certified course in pediatric bioethics from USA. She is a secretary of Indian Academy of Pediatrics, Karnataka State. Currently, she is working as professor of pediatric department, Jain Medical College, Belgavi, and head of neonatal unit in KLE's Dr Prabhakar Kore's Hospital and MRC, Belgavi. Special interests are in neonatal nutrition and follow-up of high-risk newborns. So let's meet very knowledgeable and very graceful Dr Manisha Bhandankar ma'am.
Namaskar.
Namaskar. Welcome to Saptapadi Vivah ma'am.
Thank you, and thank you for giving me this opportunity to have a discussion on some very interesting and very important topics.
Yes.
Yeah.
So let's start with our session.
Sure.
My first question, it is said that mental and emotional state of a pregnant lady will have significant effect on the baby. So what is your perspective about it?
Pregnancy itself is a very highly emotional state, I would say, because there are a lot of hormonal changes which happen in the mother during pregnancy. Associated with that, the mother's emotional state, we know that there are what is called as happy hormones like dopamine, serotonin, oxytocin. These are called as happy hormones.
Okay.
And they have effect on not only just the mother's emotional state, mother's health, but they also have equally important effect on the growing fetus in the mother's womb.
Okay.
See, the baby is born, brings the genetic component from both the mother and the father, okay, when the embryo is formed and when the fetus is forming. Expression of those genes inside when the baby is being formed, and even later on in pregnancy and even later on during the birth of after the birth of the child, during the development, all this depends upon what sort of environment the child is in. So okay. It starts from in utero itself. If the mother is happy, if she is in a stable state of mind, that gives a much healthier environment for the baby to grow. There is enough research which has shown that mothers who have been exposed to intense stress during pregnancy, like those who have been involved in war-like conditions, okay, or those who have been involved in famine-like conditions, though they have given birth to so-called healthy babies after the completion of pregnancy, there have been effect on the mental health of these children which has seen even when they are become adults.
Okay.
So the first trimester, especially the first 3 months of pregnancy, we call it as a trimester of organogenesis. So when the organs are getting formed inside. And formation of organs just don't depend upon the genes what the baby is carrying, but also expression of the genes. So having a very stable environment for the mother, not getting exposed to domestic violence, abuse, physical abuse, or even verbal abuse during pregnancy, the stress which is there in if there are those who are in high profile jobs, and the stress which they bring they get in the work environment, and they bring it home also later on, all this will affect the mother's health, and definitely it will affect the fetal health. It will also affect the mother's sleep during night.
Right.
If she is relaxed, she will sleep well, and that is another very important thing which should happen during pregnancy, that mother should rest well. See, in our culture we have this sort of small celebrations which we have when she goes into, when she completes first trimester and she goes into the fourth month. Then we have a celebration when she gets into the seventh, she completes seventh and goes into eighth month.
Baby shower.
Yes. Why are these celebrations exactly during those days? Because once she has completed 3 months, that means one of the important milestone of pregnancy is over. Okay, and now it is important that she celebrates and be happy with it. When she completes 7 months and goes into an 8th month, that is another big milestone of pregnancy which is completed. And her being happy, her being satisfied, her tastes to be satisfied, because we make lots of food preparations what she likes. So all this is giving her an environment wherein she feels happy and the baby also feels welcome. That yes, this is especially very important for the baby's not just the development but the mental health later on in life.
Okay. If a couple indulges themselves into too much of fast food or say junk food, how it can hamper pregnancy and later on overall growth of a baby?
See, pregnancy is not just when a couple prepares themselves for the pregnancy, or when the lady prepares herself for the pregnancy, it is not just the pregnancy that we should be looking at. The pre-pregnancy health of the mother is also equally important. The health during pregnancy and later on when she is feeding the baby, all those are all important aspects of maternal health. What is junk food? Junk food is especially, it contains all this refined flours, then oils, refined oils. It is usually all deep fried. A lot of sugar, salt, because it all satisfies our taste buds. But what we need to remember is what comes along with the junk food. Now it is what is called as empty calories. Okay, what junk food gives is empty calories. It does not contain proteins, it does not contain vitamins, it does not contain all those micronutrients which are required for the health. Now it is shown by enough research, and science has shown that the mother's health prior to pregnancy is also important. What we have seen in the recent years is there is increasing trend towards mothers developing gestational diabetes, that is diabetes during pregnancy, mothers having obesity pre-pregnancy and which is having its effect during pregnancy, mothers developing thyroid disorders. Then there is something we call as pregnancy induced hypertension, that is increased blood pressure during pregnancy. Nearly 1 in 10 pregnant women have some or the other of these problems. What happens because of this problem? They will affect the growing baby inside her in some or the other way. I can't discuss what all can happen because of each of that. But the junk food, it is known to give these empty calories and leads to fat deposition which is unwanted. That brings in obesity, which is not healthy. That increases insulin resistance. So pre-pregnancy itself, the mother's body may not be in a most healthy status if she is used to junk food. If this mother continues with the junk food during pregnancy, then all these problems will get multiplied, and incidence of, again as I said, obesity, gestational diabetes, all these will increase during pregnancy. Diabetes by itself will have effect on the growing baby, in the sense we have what we call as a large baby, which is not a healthy thing. It's not that every large baby is a healthy baby. And then there may be effects on the development of various organs of the baby. Post delivery we will have problems with the baby. If the mother has obesity, then she will have multiple problems during pregnancy. So junk food is something which is very important to be replaced by healthy food during pregnancy. See, mother needs good iodine supplementation, which is important for the mental good, the brain development of the growing baby inside her. She needs proper iron supplementation, she needs proper vitamin supplementation, calcium supplementations, and this she should be getting it in the required, what you say, RDS, or required daily allowance, what she needs, and which is higher during pregnancy.
Okay.
Indulging in junk food, what happens is her routine diet will get affected. And so intake of this, some mothers may say, okay, what if we go once in a month? Other days I will have healthy food. That's a good thing. You know, you make sure that you have healthy food throughout the month, and maybe once and twice a month you go out and have some of this to satisfy your taste buds.
Right.
But then we have to be careful about the hygiene, the way it is prepared, the water that is used, the cleanliness of the hands, the vessels which they give. Because if some infection gets in through this, again there are, you know, cascade of events that can happen.
Okay.
So a lot of things need to be kept in mind by the mother when she is preparing herself mentally for the pregnancy, the couple, I would say, not just means to take care of her health prior to the pregnancy, optimize it, and then get into the pregnancy, so that she can be, you know, she can be sure of having a healthy baby throughout and later on also.
Okay.
Yeah.
Okay. Ideally, how a couple should prepare themselves for procreation?
Earlier, there used to be, a couple used to have 5, 6, 7 children.
Right.
Okay. So there wasn't much thought process which used to go behind pregnancy.
Okay.
But now every couple would go 2, and most of them probably will go for one child.
Right.
So when you are going to have 1 or 2 children for yourself, then I think the couple should think over, how am I going to prepare for this? So first of all, as we discussed, have a good emotional stability. The couple should decide that, okay, now we are ready to go into taking parenthood as another responsibility in our life. Second thing is health. So they now it is recommended that the couple should go and get themselves tested, examined, you know, ensure that especially if the lady, she should ensure that she doesn't have any issues such as urinary tract infections, or sometimes some problems with the heart, kidney, which could have got missed otherwise because she was keeping well, but which may just come up during pregnancy. If they are obese, make sure that they have you know, regular exercise, bring their weight under control. So health wise she has to prepare for herself. And then and financial stability is also important. Okay. And also I think now, since they are going to have 1 or 2 children, they should think of how are they going to take care of this child later on. It is important that the parents are relaxed and enjoy the parenthood. Okay. I always tell, I work in neonatal intensive care unit, okay, wherein we get babies who have had problems. No parent ever thinks, you know, that their baby would be born with problem. Nobody is ever mentally ready for it.
True. Right.
But sometimes things go wrong. Premature deliveries happen, or problems happen at the time of delivery, or after birth we realize that there is some problem with the baby, and then these babies come into the neonatal intensive care units, and then we find the parents are so devastated. Pregnancy and parenthood is taken for granted by many people because they have not looked at what problems people face to get pregnant.
Right.
Okay, because pregnancy has happened, you know, as a part of a natural process for them. So they have not looked at the problems of those who are struggling to get pregnant. Right now, it is a huge number in India. They say at least 1 in 10 couple is struggling to have their own biological child in India.
Oh my God.
Okay, so that's a huge problem, infertility. So those who naturally conceive, they take pregnancy for granted. And then they have a normal birth and everything goes on well, and they take parenthood for granted. But then when there are some catastrophic events which happen during pregnancy or at the time of birth or immediately after birth, that time we find that these parents are totally broken. They don't know where to look for, for that emotional backup, for that the support which they need. So prepare yourself for family support as well. Family support is equally important for them to relax during pregnancy and then to enjoy the parenthood which comes later on. I always tell the parents when they bring the children for the mothers who are struggling to breastfeed, those who are saying I am not getting enough sleep after birth, after delivery, and then they come back afterwards with the baby saying that my baby is not eating this, my baby is not doing that. First thing I tell them is just relax. You have become parents, enjoy the parenthood. To enjoy the parenthood, they have to have good support. So when a couple is preparing themselves for their own biological child, for procreation, I think they have to consider all these things, and how are they going to take care of the baby once the baby is born, till there and later on also in life. All these things, I don't say that you can plan everything in life, okay, but mental preparation at least should start even before pregnancy.
Okay. I've heard like there is an increased birth rate of special children.
Yeah.
So is it true?
To say that it is an increased birth rate or increased rate of children born with special needs, we can look at it two ways. One is, probably there were these children earlier, but they were not getting recognized. Especially children with learning disabilities, having problems. We have heard of a lot of people saying, oh, I had reading difficulty, I had difficulty with maths, I had difficulty in remembering spellings. A lot of people say it once they have reached adulthood. So probably they had all these difficulties when they were children. Okay, so we are getting that recognized earlier. So that adds to the increasing number. But then there is one more factor which is increasing this number, is because of the increased rate of children who are born with prematurity, then children who are born with difficulties at the time of birth, or the children who have been small at the time of birth, what we call as a low birth weight baby. So these are the issues which are, and then children who are being born with what we say is congenital anomalies. Earlier what used to happen is a baby who was born with some heart defect or some other defect in the bodies, they were not getting treated because there were no enough facilities available. But now in the last decade or two, there are enough facilities available to take care of even difficult anomalies. And then these babies are surviving, and they are surviving into adulthood. Okay, so that is also adding on to the number of special needs children. But then there is a big group of these babies, I would say 15% as per the recent 12 to 15% of the babies, like 12 to 15 every 100 babies who is born with some problem or the other. That baby maybe prematurity itself is 12%. Okay, to add to that, there will be babies who would be born with some birth defect. There will be babies who would be born with difficulty at the time of delivery. There would be those who would have born to mothers with diabetes, or mothers having problems themselves, mothers who are emotionally depressed. These sort of also add on risk factors to this. We call them as high risk babies.
Okay.
So this number of high risk babies is increasing, which is adding on to them may becoming special needs children later on.
Okay. So are there any ways by which we can control this?
Not everything is controllable, but there are certain things which are in our hands. I think it starts with the couple, as I said, preparing themselves for pregnancy, and pregnancy at the right age. Okay. So we know that, see what's happening now, the girls they want to have their own career. They want to earn well. They want to be independent. Then they want to think of marriage, and then they think of pregnancy. By then they are usually completed 28, 30 years. The ideal age for pregnancy is 25 to 30 years. That is when our body is ready for the pregnancy. After 30 years, then we start seeing problems associated with pregnancy. So as every year passes by, there is some or the other issues that may start cropping up. So first of all, preparing themselves at the right age, then ensuring that the mother is in good health, because we want to prevent prematurity. As much as possible, if we can prevent premature birth, and what leads to prematurity, all these issues which I said. Young mothers, teenage mothers, increased incidence of prematurity. More than 35 years age of the mother, increased incidence of prematurity. Blood pressure, increased blood pressure during pregnancy, diabetes during pregnancy, stress during pregnancy, all this will increase the incidence of prematurity. Also, the weight of the baby inside the mother, when the baby is growing inside the mother. See, the normal weight what we are looking at is more than 2.5 kilo. So 2.5 to 3.5 kilo at the time of birth is what is a good weight of the baby. A baby who is born less than 2.5 kilo is at increased risk, because that baby is born with lesser immunity. Baby has lesser resistance to fight with the infections. So there is higher incidence of infections in those babies. Higher incidence of, they may be requiring support to breathe. Higher incidence of possibility of their sugar levels going down. All this is affecting it is not just the survival of that baby, but the growth of the baby later on, and the most important is the brain. Because every small incidence which happens, especially immediately after birth, in the first 4 to 6 weeks of life, is affecting the growth of the brain of the baby.
Okay.
So, and everything means, what we say as special needs child, is we are talking about the growth of the brain growth.
Right.
Okay. Now, and it is not just during that period, it is even later on during the early infancy, that is the first year of life, how the baby is being taken care of by the parents, how much time the parents spend with the baby, how much quality time they give to the child, all that influences the brain growth.
Right.
Okay, and so if we want, as I said right in the beginning, the first statement, not everything is under our control, but the factors which are under our control, we should take care of, so that we don't add to these numbers of children with special needs.
Okay.
Yeah.
If a woman undergoes recurrent abortions, what are the consequences associated with it?
Yeah, so I'm talking up from the pediatrician's point of view here. Obstetricians will have their own different things to say about it. Now, the recurrent abortions could be two. One is, it could be spontaneously happening, or they could be done induced because the couple does not want the baby. Okay. If that is something which is spontaneously happening, then that is a big issue in that lady getting pregnant. We see lot of such cases these days. And again, as I said earlier on, all those factors, diabetes, thyroid disorders, hypertension, and to some extent the age of the mother also, all these have been known to be related to recurrent abortions, spontaneous abortions. And another important factor is genetic disorders. Suppose if there is something wrong with the genetic makeup of the embryo, of the fetus who is conceived, then in that case we have to do a complete workup for the parents also, to look at what is their genetic makeup. So there it needs extensive studying, investigations. But if that is something which is induced because the couple does not want the child, what is happening is they are interfering with the reproductive health of the mother.
Very true.
Okay, first of all, the mother should be, if she is in the age group of what is supposed to be, she is supposed to be getting pregnant, I think the couple has to think really twice of why they don't want the baby. Because we have seen mothers who have avoided to continue with the pregnancy because they didn't want the child at that point, and then later on they struggle to get pregnant. Okay, because basically they are interfering with the anatomy, the hormonal structure of their own body, and that is what then prevents them from getting pregnant later on. So what I would suggest to the ladies who want their own biological child is plan for it rather than going for unwanted pregnancy. Of course there are sometimes situations wherein they really can't afford to have a baby or whatever, social reasons may be there, but as far as possible, please don't interfere with your reproductive health.
Okay.
Yeah.
That's very true. So how a mother should prepare herself post delivery?
Yeah. Now that is another important thing. During pregnancy, or probably by the end of the pregnancy, most of the mothers are getting exhausted. And once the delivery happens, what I find is and the pain during the delivery and the exhaustion at the end of delivery, what I find is the baby is handed over to the grandmother, and the grandmothers are happily taking care of the baby. But where is the bonding between the mother and the baby? What is recommended now is immediately after the birth, the baby should be placed on the mother's chest, what we call it skin to skin contact. Okay, so the baby is naked baby is placed on the mother's skin, so that skin to skin contact which is there, that helps to develop the bond between the mother and the baby. That also stimulates production of milk.
Okay.
And see, there is nothing like breast milk, we call it as liquid gold or amrut, that is what we say. So the stimulation of the secretions of the breast milk from the mother is very important. As early as it happens, it is good for the baby. So mother has to be mentally prepared for this prior to the labor or prior to the delivery. She should be prepared that first of all she should be very strongly deciding about that I am going to exclusively breast milk my baby. There is nothing else that the best gift a mother can give to the baby than her own breast milk.
Right.
And there are multiple reasons for it. There is one thing which probably I should have had said earlier when we were talking about junk food during pregnancy. There is something called as gut breast axis. Okay. Now what do we mean by gut breast axis? During pregnancy, the mother's breast is getting prepared for breast milk.
Okay.
And what is supplying the information to the breast to get prepared is the mother's own gut. So the nutrients what the mother gets, it gets absorbed in her own intestines, and then they are taken to the breast. So it is sort of a messenger system to the breast, wherein the breast is getting prepared to and getting the milk ready for the baby who is going to be born. So having healthy diet during pregnancy is equally important to prepare herself for this breastfeeding post pregnancy. The breast milk, again, it acts as a messenger from the mother to the baby. This breast milk, it induces good immunological reactions, in the sense the resistance in the baby to fight with the infections. Baby's own endocrinology, like what we say, different hormones which our body needs to secrete. The baby's growth of the brain, the omega-3 which is required for the growth of the brain, all this comes from the breast milk. So the mother has to be but see, breastfeeding is not an easy process. It is not like you put the baby to the breast, baby starts sucking and everything goes well. It requires lot of physical effort by the mother.
Okay.
And mothers get tired and they give up. Okay. And the golden opportunity which is at that time which is there to develop that bond between the mother and the baby, and to pass on that breast milk from the mother and to the baby, mothers miss on that golden opportunity because they are not emotionally, mentally prepared for that physical hard work to be done to give that breastfeeding. They have to wake up at night.
Right.
Okay, every 2 hours you have to feed the baby. So I always tell the mothers, motherhood is not easy. So just by having a child does not mean that, you may have become biologically, you may have become the mother, but to enjoy that motherhood, you have to be emotionally and mentally prepared. You should be prepared for that physical hard work which is required. What happens then? The mothers hand over the baby to the grandmother, who will happily feed some other milk to the baby. And we are, such a golden opportunity which is there to develop that whole thing of having a healthy baby and develop that bond, which is lost by these mothers because they have not thought over it. They have not prepared themselves for it.
Right.
So I earnestly request all those who are thinking of having the baby, just don't think of pregnancy, but think of that post-pregnancy situation. Prepare yourself mentally and emotionally. That is what we say as post-pregnancy blues also. There's a lot of hormonal changes which are happening. They may get psychologically affected at that point. There is a very high incidence of depression during this first 6 to 8 weeks after pregnancy, after delivery. Postpartum depression which is there. Yeah. And it all affects their own emotional health, and which also will affect the breastfeeding also. So that is one part of it. And then taking care of the baby later on during the first 2 years of life. What is the concept which is called now is first 1000 days of life. The journey to first 1000 days of life, I think that is the most important gift any parent can give to the child.
First 1000 means right from the
from conception. We are not talking about post delivery also. We are talking about from conception to first 2 years of life. So these first 1000 days of life is something which the parents have to really give their attention to the child. Why so? See, the brain is formed when the cells of the brains are formed when the baby is in utero. What happens after birth? All these cells, they keep getting connected depending upon what experience the baby has through this first 2 years of life. So there is sort of multiple connections which are happening every second, in fact. What the baby sees, what the baby hears, what the baby tastes, what is the touch what the baby has, how much love, affection the baby is getting. Depending on that, all these connections are happening in the brain. After 2 years, 2 to 4 years, the next important stage, out of these connections, those which are not wanted or which are not being utilized, they are sort of lost. See how we do pruning for the tree? If we don't want certain branches, we cut them off. Same thing happens with the brain. So first all these connections are formed, and then later on, depending on the experience the child is having, positive or negative, whatever experiences, if the child faces abuse, neglect, malnutrition, emotional deprivation, so all these negative feelings also will affect that pruning, as well as love, affection, good nutrition, good healthy environment, lots of joy and laughter around the baby, that also will affect those these connections. Okay, and that is all that the parents have to look after in the first 2 to 4 years of life. So journey through the first 1000 days is ensuring that the child gets good nutrition, child is in a happy, stable environment, because again there is another concept which is called as epigenetics. See, the baby is born with certain genes, but the expression of those genes depends upon the environment in which the child is in. Okay. The changes happen at the level of the DNA. Okay. So, and that is what is epigenetics. So, if the child is in a good healthy environment, there will be the expression of the genes will depend upon that. So that is something which is in our hands. This is what the parents have to remember. So, the parents should be aware about what sort of nutrition they should give to the baby, what is healthy nutrition, how to first of all give exclusive breastfeeding to the baby in the first 6 months, then after 6 months the complementary feeding. What do we mean by that? Many mothers, I have to literally tell them, please, tea and biscuit is not a staple diet for the child. Of course, educated mothers are aware about it, but then those who come from lower socioeconomic status, they still think bread, biscuit and chai is something which they are very happy to give to the child. So that is not the staple diet. So complementary feeding is what. And then how to interact with the child. So that is also something parents have to prepare themselves and ensure that I am going to give this amount of quality time to my child, especially in those first 4 to 6 years. What I would earnestly request the parents is, give the best possible quality time in the first 4 to 6 years of life for the child, and you have made a strong base for the child to be a good human being, to be a stable human, to have good emotional IQ and good sort of relationships later on during adulthood.
Okay.
Yeah.
They say marriages within same Gotra are not allowed because it can lead to genetically compromised progeny.
Yeah.
What medical science says about it?
When we think of marriages within Gotras, what are we looking at? We are looking at basically the genetic material which is going to come from both the parents. Why was Gotra considered as important? I think it is equivalent to considering avoidance of consanguineous marriage. What we say is consanguinity in medical language. So avoidance of consanguineous marriage is something which probably Gotras were saying earlier. What in the present situation we have to look at is, it is not just the Gotras. What I have seen in the community over here, especially in Belgaum, is that lot of marriages happen within the relation, like uncle niece or close cousins, first cousins getting married. Now that is what is not good for the genetic material which the baby is going to receive from both the parents. So probably in the present situation, instead of looking at the Gotra, maybe now the Gotras have gone through generations.
Right.
Okay. And what we used to be worried about earlier, probably what our ancestors were worried about earlier, is baby being born with some defects if there are husband and wife from the same Gotra getting married. What we need to remember now is, husband and wife should not be having the consanguineous marriage, that is within the relation. So instead of looking at whether they are from both Gotras, they may be from two different Gotras, but they may be very close relations. So that is something which we need to look at, because that is which is going to give, we see increased incidence of birth defects, especially in the rural community around Belgaum. We find lot of babies coming with birth defects who are born to parents with consanguineous marriages.
Okay.
So I would earnestly say that please look at it before thinking of fixing a marriage within relation. Yeah.
Okay. So my final question to you,
Yes.
your valuable suggestions to prospective brides and grooms for their happy married life.
If we look at this younger generation now, career is very important for them. They want to be independent, they want to feel confident, they want to be on their feet before they even consider getting married. But then parenthood is it's a natural feeling, something which everybody who would get married, and then they would want to continue with the family and have their own biological child. So thinking of this later on in life, after 30, after 35. So what I would say to this younger generation is that think of marriage at a marriageable age. Plan the pregnancy, ensure that you have healthy lifestyle prior to pregnancy, during pregnancy. Think how you are going to take care of your children later on. Ensure that you have good family support.
Okay.
Nuclear families is something which is bringing a lot of stress on these young couples.
Right.
And it is making them difficult to bring up children, and that is why many couples are thinking of one child. They stop at one child because they don't have the family support.
Right.
Family support is equally important. So ensure that you are surrounded by family members whom you love, friends whom you trust, so that when your child is being brought up in this sort of positive atmosphere, your child is going to be growing up as a good human being and good citizen of this country, and who is going to be a valuable asset to your family later on also.
Right.
So think of all these things, and then plan your family and ensure that you have a happy married life.
Wow, wonderful.
Yeah.
Thank you so much, ma'am, for guiding us through this wonderful session. I really appreciate your time and the information you have shared with all of us. Thank you so much.
Thank you very much, Snehal, for giving me this opportunity to join in this session. Hope the discussions which we have had today help the young couples to plan for and have healthy babies,
Right.
and of course have a very healthy married life throughout. So thank you very much, and I wish you all the best for all the work that you have been doing through saptapadivivah.com.
Thank you, ma'am.
you.
Thank
Yeah.
you.